I know how I felt with one round of chemo, and it was awful. I couldn't walk up the stairs. I didn't want to talk to anyone.
Coming up on today's Morning Medical Update, this young father was diagnosed with a rare stomach cancer, but a mutation in his cancer turned out to be a good thing and drastically changed how he was able to be treated. We'll show you how Austin was doing 4 years ago, and he'll tell us this morning how he's doing now. Good morning. So glad you're with us today. It's November 7th. I'm Jessica Lovell, and we are live inside the Dolph C. Simons Jr. Family Broadcast Studio. The American Cancer Society reports early-stage stomach cancer rarely shows symptoms. That means most stomach cancers aren't found until it's too late and has spread outside of the stomach. Today, we take you inside the OR to show you a unique treatment offered here that is fast becoming a national trend in how we treat certain cancers. So get your questions sent in to us through the links right here on your screen, or you can drop them in the chat thread below. We'll get to those in just a bit. But more than half of those diagnosed with stomach cancers are 65 and older. That was not the case for Austin Hill. He was in his early 30s, the prime of his life, when he was diagnosed with stage 4 metastatic gastric cancer. We met with Austin back in 2018 in treatment, but truly hopeful.
I just had a little bit of a stomach ache and went in to see the doctor. They thought it might have been something bacterial.
It wasn't bacterial. When 29-year-old Austin Hill went in for further testing, the news wasn't good.
They diagnosed me with adenoid carcinoma, which is a form of cancer, and they said that they would like me to go see a doctor over at KU.
It was here at the University of Kansas Cancer Center that doctors became aware of Austin's grave condition. When he did not respond to the chemo, doctors told Austin that qualified him to try an immunotherapy regimen.
Instead of killing the cells with chemotherapy, we're actually going to reprogram your immune system to go and attack these cancer cells.
The general population for gastric cancer, we don't find this treatment is super helpful.
Which makes Austin's response to the immunotherapy treatment quite rare.
What caused the cancer, we call it genetic defect or tumor markers. For gastric cancer, stomach cancer, for the MSI population, it's only about 5 to 10% of people have this mutation.
We just tried to find the silver lining.
Austin became a father for the 3rd time shortly before his diagnosis.
When I'm up in the hospital, she slept on the couch, with my wife for many nights. I mean, she was kind of like our team mascot. The surgeons would come in and step over her, and they would all, people would come into the room and just look at the baby, and, it made everyone happier. But the physical pain isn't as challenging as the psychological pain. And that's really the part that you have to get over.
And he's had a few setbacks, including a 50-pound weight loss. And although Austin is told he'll never officially be considered cancer-free, that's not stopping him from living like it. He continues to fight. He's back to his workouts, and most important, coaching his son.
I want my kids to be old enough to know who their dad was. I want to take my son hunting. I want to take my daughters to their first daddy-daughter dance. I want to be there for my wife throughout the rest of our lives.
Ed Austin joins us today along with gastrointestinal oncologist Dr. Weijing Sung and surgical oncologist Dr. Mazen Alkas-Pools. Gentlemen, welcome to all of you. Good morning.
Good morning.
Austin, good morning to you.
Good morning.
Good to see you. Your scans were clean as of 2 weeks ago, something we refer to as no evidence of disease. How are you doing? How are you feeling?
Oh, it feels great. Obviously, those were the results I was hoping for, but life is good right now. I mean, I'm staying busy with the family and back to work full time. Watching that recap of where we were at 2 or 3 years ago, talking about daddy-daughter dances and being able to spend time with my wife and going hunting with my son. Those are all things that I've done within the past 6 months. So very fortunate to have the team here taking care of me, and glad to be here. So thanks for having me.
So great to see you. You were actually one of the first stories I did when I came here to the health system and started telling stories. And your big story back then was you had baby number 3 there, Vivian, in the hospital. But since then, you've been really busy because now Mary's in the picture, baby number 4.
Baby number 4 is here. Mary is we refer to her either as Miracle Mary or a funnier term that we like to use is Critter Mary, because she seems to be the one that gets into all the snacks and breaks all the rules. So, but we're very blessed to have her and the rest of our kids.
Yep, that's what the fourth is supposed to do, to kind of just get away with all sorts of good stuff. Well, we're so glad. We're going to hear more about the family in a moment, but I want to turn to Dr. Sun, because the word remission is a common word that people throw around when talking to cancer, but you say that as a slippery slope. We need to use the term no evidence of disease. Why is it so important, Dr. Sun, to understand the difference between the two?
Yeah, understandably, when any patient got a cancer, they want no evidence disease or cancer-free. However, to be objective, precise, use a medical term. Remission initially used the word for the leukemia patient. After chemotherapy, there is no bone marrow evidence of disease. So that's the remission initially come from. But the risk over there for any patient have a cancer come back, so called a high-risk disease. Today, we use the terminology minimal residual disease. Minimal residual disease means today's technology, you're not able to pick it up with those diseases precisely. However, the risk of cancer is still there because some cancer cells, today's technology are not able to find it. In the future, we may. So remission or cancer-free, this terminology is understandable used in the society, but for the medical professional, people do have a cancer, understand clearly, we use the no evidence disease. No evidence means by today's technology is the best we can do and is the most objective way.
And you use that terminology because it's your job to find any evidence if it were to come around. But as far as Austin's concerned, no evidence of disease is exactly where you want him.
Exactly. So then on the other hand, we have the vigilantly to surveillance. If, God forbid, something is an early sign, we can acting them quickly, immediately.
Surveillance. Dr. Alcaspools, you said that it is possible to pull someone out of stage 4 cancer and into an NED state, but it's extremely rare in Austin's case. Tell us why.
Yes, well, yeah, these days if someone has stage 4 disease, the classic is colorectal cancer. We can potentially cure them or make them no evidence of disease, but gastric cancer is a very aggressive cancer. It's a more life-threatening cancer. So when somebody has stage 4 stomach cancer, we find that, you know, it's almost miraculous to save somebody and make them no evidence of disease. And that's why it's unique in his case.
And we're going to talk about the unique treatment that you used in just a moment. But Dr. Sun, what was Austin's prognosis when you first met him? And how did you start to change that?
Yeah, Austin's case is very unusual when he came to us, very young person to have aggressive disease and metastatic by that time. It's a peritoneal have a disease, which means the abdominal cavity was a disease by that time. If by older technology, older treatment, prognosis overall, by statistically, average person is very bad disease. However, the most important today, the advance of medicine is we find everything, find a mutation, such as HER2, MSI, or this mutation. If we found those mutation, and we can very, very aggressive use today's new technology, not a standard chemotherapy, use a targeted treatment. So many people can be benefited if they carry this mutation, and to the point it can be complete response, another medical term, and make them no evidence disease.
Dr. Sun, you called Austin a miracle, but I have to say we often think of a miracle as an experience that has no explanation. But this was an alignment, I say, of the sun, the moon, the stars, science, and 2 great doctors. So miracle, you might say, but I think that this was a testament to really specifically treating this type of cancer. Dr. Alcaspools, Austin had a total gastrectomy with something that's called HIPEC. First, tell us what HIPEC is.
Yeah, so HIPEC is, it stands for hyperthermic intraperitoneal chemotherapy, and basically that just means heated chemotherapy that's given within the abdomen for a certain amount of time. It's circulated through the abdomen after you remove all the cancer within the abdomen. But when I say remove the cancer, it's a different kind of spread. It's not like the kind we think of where, you know, the cells get in the bloodstream and go inside an organ. This is different. This is where the cells escape the organ within the abdomen and actually land on the surfaces of the organs and the inside of the abdominal wall. So it's a different kind of spread. So you basically go in, remove all the disease, and then give the heated chemotherapy.
So who would typically be a candidate for something that we're seeing here?
Yeah, so it's It used to only be performed for appendiceal cancers. So most recently, it's now shown to have a lot of benefit in colorectal cancer as well as ovarian cancer and mesothelioma of the abdomen. But we do have evidence now that it is helpful in patients with stomach cancer. Now, we have to be very selective. You know, the person with stomach cancer, number one, we have to get it all out, but also they can have a tremendous amount of disease in the abdomen. Otherwise, we don't think it's as beneficial. Yeah.
Well, and you led a national effort to expand the use of HIPEC,
Yes.
Which is kind of what you just explained, because you know, this is used for specific cancers, not all. Why were you so confident, though, that this might work for Austin?
Well, I wasn't confident at first. When I first, when I first met Austin, and even during his first operation, his disease was such that I wouldn't have considered him for a HIPEC procedure. I told him that our best, if we can get lucky, if we can have less volume of disease within the abdomen, then I'd consider him for the HIPEC procedure. So really, it was a great team effort, like you mentioned, because Dr. Sun gave him an agent that worked tremendously, and that allowed the volume to go down in his abdomen, which then allowed me to do the procedure. Otherwise, I wouldn't have thought he was a good candidate.
Austin, I want to bring you in here just to kind of talk about your own treatment, because chemotherapy made you very sick. You went on to immunotherapy, and then you went on to HIPEC. So kind of walk us through the last 4 years of your treatment and the changes and how they were for you.
Yeah, initially I started off with chemotherapy, and it was only a brief, maybe 1 or 2 weeks of being on that particular type of therapy before switching over to Keytruda, which was the immunotherapy that I started on. I think I had heard horror stories of what it was like to be on chemotherapy, and unfortunately, with immunotherapy, I didn't have those same side effects. So I think the worst things that I experienced being on immunotherapy were maybe some headaches, joint pain, fatigue, but other than that, it wasn't like I was losing my hair or had skin issues or anything like that. Leading up to the HIPEC, I had started chemotherapy again just for about a month, and felt really sick on that, but I don't know if that was from the actual treatment or if that was just the progression of the disease at that point. I think you could probably point at both factors as being a reason for my nausea. So following the HIPEC, I did about 6 months of chemotherapy in addition to the immunotherapy treatments. And now what the treatment plan is, Dr. Sun, we're still trying to figure this out, but I think for right now we're doing every 6 weeks. I get another infusion, but I mean, the side effects right now are relatively insignificant. I mean, I don't have any toxicity to it. The joint pain is minimal. So, if there's something good that it's doing, why stop it? So we're going to continue to do it, and if things, we'll just reassess as things go. But we're kind of in uncharted territory, I think. So I'm just along for the ride, and I trust Dr. Alcaz and Dr. Sun.
Dr. Alcaz, I love it. Okay, so I want to go back to these pictures of you in the hospital, if we can, guys, because I see you smiling. I see you being a dad. I see you being present. How were you able, I know that your faith carries you through, Austin, but how were you able, and how important was that when we see these wires coming out of you and you're tired and you're sick? What got you through? How'd you do it?
That's a good question. It wasn't easy, and it's still not easy. I think at the timing of the HIPEC, it added a little more complexity as well, because the hospital had shut down because of COVID about 2 weeks prior to my surgery. So not only was I going through one of the most aggressive surgeries that a person can go through, but I had to do it a lot of it on my own. I was in the ICU, and then I was an inpatient patient up at the Cambridge Tower for a while. So that was tough. I think a lot of the support came through text messages and conversations with my wife when I had the energy to do so. But I bring it back to 5 factors, and you had mentioned it earlier about this being a miracle and being able to point to certain things that contributed to that. But I do think that the 5 things that really carried me through, we have my faith obviously is number 1. Medicine is number 2, and a lot of times people look at those as being mutually exclusive, and I don't think that's the case here. I think that those 2 worked hand in hand together. 3rd would be my family. 4th would be the community that I am surrounded with, either through my church or through the neighborhood, through friends and family across the nation that were reaching out to support us, and not just me, but my wife and kids. And then lastly, I think, I do have to take some ownership and credit for the mindset that I had throughout all of it. There were times where it was not easy. I was depressed, especially in the hospital, and Dr. Al Kespools was one of the few doctors that actually came back in after they made their rounds. He came back into my room just one-on-one and asked me, are you okay? And that was the first time that anybody had really asked me that over, a 1 week, 2 week period. So I think all of those things combined really fed into the way that I was able to heal, and really attribute a lot of my success to those external factors, but then focusing on the things that I could control, and not getting upset about the things that were out of my control was definitely a major piece of that.
And part of that was also staying active and working out. 4 years ago, we saw video of you that we showed in the piece earlier. This is you now. How important has just that physical power been for you?
Oh, it's one of the main things that I like to focus on. I mean, there is no better way to feel like you're in control and you have some kind of say in the way that your health is dictated by working out, eating right. I did all those things leading up to my diagnosis, which was probably the biggest shock to most people that knew me. When they found out, it was like, wait a minute, Austin, the guy that hasn't had a soda in 5 years and works out every day? Yeah, that's the guy that was diagnosed with stage 4 cancer. But that hasn't stopped me. I never became upset about, feeling like I wasted my time with that stuff. I feel like that's one of the factors that led to having such positive outcomes, was being in a position where I felt like mentally, physically, I was prepared to take this challenge on. Now, moving forward after the HIPEC, this is something that I know the 2 doctors that are sitting with you at the table probably don't love me doing back squats with a bunch of weight on my back, because I don't need to have another unnecessary surgery. But it really does, continuing to push myself and making myself uncomfortable. I think it keeps my mind sharp, and I think that it allows me to give myself the strength to continue on to be a father, to be able to coach my son, to be involved every day and have the energy to do those things. But then at the same time, it's the mental clarity that I get from that, and understanding that whatever happens, if it's in my control, I'll take care of it. If it's not, then I'll pray for the strength to get through it. And I've had a lot of support with my wife, encouraging me to continue to work out. So that's one thing that I'll continue to do, and I'll continue to do it until my body says I can't anymore. So.
Yeah, he's going to be a tough one to stop, Doc. Sorry, I don't know what you're kind of just going to have to go with it.
I was going to say, that's not a common result. Most people don't look like that after a gastrectomy, so don't expect that after a stomach. Whenever your stomach is completely removed.
Okay, yeah, but that's a lot of determination. You mentioned your wife, and she is here today. And I'm sorry, I'm not going to miss the chance to take a peek into our control room where our guys are. And there's Maggie and Bob and Logan are in there, and there is your wife, and I know she has been by your side the whole time. And today is no exception, so we're glad to have you. Thank you for being with us. I want to talk to you about, first of all, we're going to put a QR code up because there is a trial for HIPEC going on right now. Austin was not on the trial, but I want to hear more about it and how people can get involved.
Yeah, like I mentioned before, the use of HIPEC is expanding. And so one of the areas that is most useful in is colorectal cancer, because colorectal cancer can spread in the way that I just described very commonly. And so really it's for patients with colorectal cancer that have that kind of spread I just described. And basically, one treatment is is compared to another treatment. So a more standard treatment is compared to a newer treatment. Because in the world of HIPEC, we're still trying to tweak it. We're trying to determine what are the best ways to give the chemo, the best agents to use. So really, so it's for patients with colorectal cancer with that kind of spread. Is what it's used for.
We're going to get to some community questions in a moment. I want to take a quick break to check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, with our COVID count today. Good morning. Happy Monday.
Hi.
Hi.
How are you?
Good.
Right now in the hospital, we have 26 active infections, with 1 in the ICU, 1 on the ventilator, 12 in that recovery period. So, again, still hanging out, unfortunately, in those high teens, low 20s, mid 20s. Just saw today on the CDC reported number of cases has kind of inched up a little bit. And again, now they're reporting weekly. There was about a plateau for 3 weeks. So we'll just kind of wait to see how that goes. Hopefully there won't be a significant surge like there was with Delta or even this last Omicron surge that we've come out of as well.
All right, Dr. Hawkinson, I have a question about RSV because that's been in the news, and we know that this has been a rising infection among kids and adults, but two promising tools to prevent RSV in infants could soon be available if regulators agree that they're safe and effective. Vaccine expert Barney Graham, who you said actually started out researching RSV, he is now commenting on the progress of this. What do you know about that? And of course, what are your thoughts?
Yeah, I mean, I think it's great. I think, Barney Graham is obviously an expert. He's helped with the COVID-19 vaccines. He initially, I believe, started out as researching preventive measures, vaccines, or treatments for RSV. It has been a long time. We know the morbidity and mortality that RSV can cause, both in infants, but also in older age adults as well. Right now, this story is regarding the infant protection. And we saw a little bit about this last week, giving the vaccine to pregnant mothers. They will develop an immune response, most notably antibodies. Those will transfer to baby to give that baby protection for about 6 months. It showed very good interim results, and I think this is one great thing. And certainly, if Dr. Graham is behind it, he obviously knows the ins and outs of all that science and data. It's a very good thing as well.
All right, Doc Hawk, thanks so much. Any reporters on the line? Let's get to our community then. Angie wants to know, Dr. Sun, are there screenings for stomach cancer?
Yeah, so the question is right now, the stomach cancer, overall percentage is small, relatively small than the stomach cancer or breast cancer. That's why there is no national endoscopy routine screening. So however, on the other hand, they take the both sides, our average people, you have an early sign of the stomach upset, or those stomach upset are not responding to good early, like a medication for reflux symptoms, you need to pay more attention to them if you swallow difficulty, or somehow, long-term unexpected information, you need early sign, you need to pay more attention instead of say, hey, this is average. And the medical doctor, especially like internal medicine doctor, family doctor, also need concern if those patients did not respond to regular infection, because infection stomach upset still relatively way more than cancer. So that's on the one hand, we'll vigilantly to think about it. On the other hand, no panic. So that's why it's a take the village, for both sides, for doctors and the patient to notice the early sign. And if needed, it is to have an endoscopy, because this endoscopy is very reliable to find those early cancers.
Jean wants to know if stomach cancer has a genetic link.
Exactly. So the question, about 10% of patients have a cancer, they go with the family. Some we know the information because this area is still advanced, have breast cancer, colon cancer. Those genes are specific genes, they can also involve with stomach cancer. So for those patients, doesn't matter which type of a cancer, if especially cancer happened to family member early age, you should always do the genetic screening testing and the surveillance and see early kind of consultation, genetic consultation specifically. And then you should remind your doctor as well, your nurse practitioner, and they should also pay more attention to those population. So because the general guideline may not apply to those population, we need early and take the team to work on it, not just like, hey, I'm physically normal. Physical symptoms, those textbook physical symptoms, many times not reliable for early sign.
Good to know. Thomas wants to know, Austin, was the pandemic a scary time for you? You had young children, new baby, and then you're also trying to protect your own health. What was that like for the family?
I mean, it made things a little more difficult. I wouldn't say it was scary. We weren't scared because, for the most part, we were at home anyway. I think it definitely made things more challenging on the treatment side because it went from my wife coming to every single appointment with me, sometimes my kids attending with me, to this very day where I have to go to treatments pretty much by myself. So I guess that's one thing that changed with it, but I think there were a lot more people that were scared about it than I was at that time. You got to think, when you've been through something like I went through, COVID doesn't seem like it's that big of an obstacle. So I think that we take it, we take it one day at a time and roll with the punches. And if COVID creates an inconvenience for our family, we figured out a way to modify our routine to get around it. So
yeah, with everything you've gone through, what's a pandemic, right?
Right. Yeah.
I saw those muscles. You got this. So I want to ask you, Austin, because you and your wife started a nonprofit called Mission 212. So 2 Corinthians 12 describes the relationship between suffering and the power of the Spirit. So tell us more about why you started this and specifically how you're helping young fathers diagnosed with cancer.
Yeah, Jessica, I'm glad you brought that up. Throughout the past 4 years, I had mentioned several times to my friends and family that had supported us that at some point I would try to give back to the community that gave so much to us. And my wife and I had this big lofty dream, it seemed like at the time, to start a foundation. Well, more often than not, cancer foundations are started in memory of people that had struggled with cancer. But I've been fortunate to see this come to fruition and still be around to lead the efforts around it. So one of the major disparities, so I'm in healthcare administration. I've been in healthcare administration for the past 10 years, and one of the things we always talk about is population health and healthcare disparities. Typically, I never thought that I would fall into one of those categories, but throughout my experience, one of the things that I noticed was there were no resources for young men diagnosed with cancer, or even stomach cancer for that matter. So at the KU Westwood Center, there's a whole wall of pamphlets about family planning and different types of cancers and different informational brochures, but there's not anything on stomach cancer. So Andrea and I took a step back, and she has a unique perspective as well because she's a former ICU nurse. She still has her nursing license and works PRN, but she understands it from the medical side, but also from the caregiver side, being a spouse of someone battling cancer at that time. So we've taken both of our unique perspectives and turned that into something that we can hopefully help support other families that might be in a similar situation, particularly young men that are diagnosed with cancer, that have dependents under the age of 18 living at home with them. And we took a step back and looked at, this isn't something where we're paying for medical bills. That's what insurance is for. There's other organizations to do that. What we took a step back and looked at was, what are some of the things that were helpful to me? And it wasn't always things that people gave me personally. Honestly, like when I was sitting there sick and in a, just bound to a chair at home, the things that meant the most to me were things that benefited my wife and kids. So things like taking care of cleaning or cooking. Maybe it's taking care of car maintenance, things that I would typically be responsible for as well outside of the home. Those are all things that we're planning to help with. But then also, like one of the other factors, when I was diagnosed, I was 6 months away from my 30th birthday. And at that time, you have to think, most people when they're 29 are still paying college loans. And I was in that position. This isn't like what you generally think of when you're diagnosed with cancer of being 65 and older. So when you take a step back and look at the broader picture of who's typically diagnosed with cancer and where are those resources typically allocated, it's for a population of patients that don't have the dependents at home, don't have the student loans, that kind of thing. So it's not, the other thing that I want to mention here is with this foundation, it's not strictly just a financial support system. So I view Mission 212 as more of a network, and that's what we're building. I mentioned early on that my faith and community were two of the top things that helped me get through this. And for a lot of people, I was very fortunate that I had a strong community, very helpful family, and great doctors, obviously. But not everyone has that. And so that's one of the areas that we've addressed is a disparity that we can potentially help with. We held our first fundraiser a few weeks ago, and the feedback that we got from people that weren't even invited to the event, they were just simply at the restaurant that we were hosting it at, they had offered, after we spoke, they physically walked up to me and offered their services and their help, and they said, how can I help? One of the dads there had mentioned that his family had been strongly impacted by cancer, and he just mentioned, he's like, look, I don't have a lot to offer, but something that I do professionally is I make homes ADA accessible. So if you have someone that's wheelchair bound that needs their doors widened out, needs a ramp to get into their house, that's something I can help with. So we've started to build this network of all these individuals that want to help, because people want to help. But in a situation that's so serious and not a great outlook, sometimes there's just people want to help, but they don't know what to do. And so this offers that pathway.
Well, you said it. I mean, not everybody has money to offer. Not everybody has time to offer, but you said they have services and other things that they can do. So I think that's fantastic that you and Andrea have done this, giving folks this platform. We put information up on the screen right here. Here's a bit.ly link, and here is the website. So click on that. It'll take you to this page, all sorts of information. It'll tell you Austin's story, and just a really great way to find support and resources, as Austin has just shared. Isaac has a question for you. This is interesting, Austin. You had stomach cancer, so are there any foods that you can't eat, or has it changed your appetite? What's the food situation like for you?
Yeah, I get that question quite a bit. And typically when people find out that I don't have a stomach, the first question is, well, how do you eat? And I give them a smart response like, well, just like you do. I put it in my mouth and I chew it and I swallow it. But I get what they're asking, and it continues to evolve, I'll say that. So initially, right after the surgery, I mean, you can't even take a sip of Powerade. You can't take a spoonful of yogurt. I mean, it is a process building up this reservoir again to where your body can tolerate these different foods. I will say that there are foods that I can be a little more sensitive to, but it's the way that I explain it is that I'm encouraged to eat the way that most people should be eating already. And that's not, you shouldn't be eating 3 large meals a day. You should be eating several small meals throughout the day. You shouldn't be eating a ton of sugar. You can eat sugar in moderation, but not sitting down and eating your whole child's bag of Halloween candy that they just got, which I'm guilty of sometimes.
Austin, I'm not supposed to do that?
I'm sorry if that struck a chord with some people watching, but every parent does it.
Yeah.
So I think, to answer the question, basically, sugar, if I can just limit my intake there, that's fine. But dairy, which I never ate a lot of dairy before, but I still don't. So I find substitutes for it. But Andrea made lasagna last night, and I sat there with the family and probably ate more than anybody else. So I think, things are going really well. And I don't know if that's the case for everyone, but it certainly has been for me.
So Dr. Alcaz, so I guess the obvious question Jen has, and I'm asking the same one, if someone doesn't have a stomach, where does the food go?
Yeah, the body is amazing. It adapts. And so the food actually goes directly into the small intestine, the beginning of the small intestine. But then, the bile and the pancreas juices sort of meet up with the food in the small intestine, and things are broken down. But Austin is absolutely, everything he said, I'm glad he mentioned, because it's a process. I mean, it's small meals, frequent. You have to avoid sugars in high volumes. But he also made another great point, is that we should be eating like that anyway, so it's healthy as well. One thing I just want to say, if that's okay, Austin's mission, right, what he's doing, his organization, is more relevant now than ever, because we're seeing a lot more cancer, aggressive cancer in young people. And it's to people in the world of colorectal cancer, that we treat, it almost seems like an epidemic. Seriously, we're seeing a lot of 20-year-olds, 30-year-olds with
Why?
cancer.
Is it because people are screening more, or
Well,
is there something else going on?
No, we're not screening more. Actually, we've lowered the screening age, though, to 45. But we don't know. That's a great question. But we're seeing it in other cancers, but it's especially most striking in colorectal cancer. And it destroys families. Like he said, it can destroy young families because these are often the people that are bringing in the money, and and it really can. His organization can make a huge difference in those people.
It's helping with that domino effect that happens.
Yeah, I think it's just spin off what he's doing. I think another organization can spin off of that organization because it's a great idea. It's a great thought in modern times.
Exactly. And bit.ly link is right there on your screen if you want to check out Austin and Andrea's foundation. I want to get to our final thoughts from all of our guests today. Dr. Sun, I want to start with you.
Yep.
Final thoughts from you.
Oh yeah, I think the most important, the question is early diagnosis is very important, early sign is important, and it takes a patient, a family, education. It's very, very important. Number two is science is evolving all the time, so that's why anytime the physician has to know, everybody has to know molecular markers, and the biology is the most important. Technology is the evolution, and on the other hand, social support, physical activity is also important for patient. Some of them unfortunately have cancer. On the other hand, the young generation has to know a lot of technology, have to use it for day in, day out life, and be warning sign is always take vigilant, this attention to this. It sounds like very unspecific symptoms. The early you have a warning sign, the better you find early, because any cancer you find early stage is very curable. And of course, Austin's case is very unique, but on the other hand, because of science advantage, those mutation marks really make a difference. The research is important. Tertiary care cancer, like comprehensive cancer, like University of Kansas, can really make a difference because the expertise are here. It's very important.
Dr. Sun, thank you so much. Dr. Alcaz,
Yeah,
final
I mean,
thoughts?
I think Dr. Sun made some great points. So obviously, never lose hope, never give up. I think Austin, what he did was remarkable, like he said. But I like what Dr. Sun said. A lot of young people, when they have these subtle sort of symptoms, they're young and they think that it can't happen to them. But just know your body when something is just not quite right. Just make sure you go to your primary care doctor and really push them. Say, listen, this is not right, and that can lead to an endoscopy. That can lead to early diagnosis. And so, yeah, I think that's a great point.
I want to share something that one of our viewers just said. Anne, and thank you for sharing. She says, I'm 65 years old. 51 years ago, my dad died from a similar cancer. She said, this is really heartbreaking for me to hear the advances in treatment. And it must be. I think we get so excited about the advancements, but then you think, gosh, darn it, if this would have been around when Dad was still here. Just what words of wisdom could we leave Anne with about these advancements and the good that comes from it?
Yeah, I mean, I think that's something it's even happened in my family. I mean, there are certain people. I mean, there's nothing you can really do. I mean, you just have to move forward. But even my father passed away from a trauma, and in modern times he would have easily been saved.
Really?
But you can't just think you can't let it just bother you. You just have to understand that that's just life.
It is life, and then people like Austin and his family get to experience it different and give back and create foundations that then pay it forward and forward and forward. So hopefully, and that's some good that comes out of things like that.
Yeah, for this particular case, I would consider, because your father diagnosed the disease relatively young, so really genetic assessment should be done, should be evaluated. That's what you can control. Your father's, I'm sorry for the past, you cannot control, but control the controllable, which is doing the genetic surveillance and watching out those details. On the other, science and the technology are advanced. 50 years we cannot do, we can do today. 50 years from today, I think the cancer is just like a common disease, like diabetes, hypertension, we can control it. So keep the hope and the science advance.
Control what you can control. Austin, I think that's how you've been living the last 4 years of your life. I want to put up that bit.ly link if we can, guys, one more time so I can read it aloud. bit.ly/ MMU Foundation, bit.ly/MMU Foundation. That is for Andrea and Austin's foundation, Mission 212. So please, final thoughts from you, Austin. And again, thank you so much for sharing your story then and coming back and sharing it now. And we hope to hear more and more from you as the years go on. Living life really well.
Absolutely. Yeah, no, and thanks again for having me. And to your point, when I was diagnosed, I think the immunotherapy treatment had been FDA approved for stomach cancer just months prior to my diagnosis. So I was very close to that, timeline of not qualifying for it. So, and it's also one of the things that helped me get through the HIPEC surgery, because that is a scary surgery when they explain it to you. It is not an easy one to process. At the same time, I was in a position where I'm thinking, what options do I have at this point? Like, this is the route that I need to go. But at the same time, I look at my wife and I look at my kids and I think about their kids, my grandkids someday, that, 50 years from now, 100 years from now, that HIPEC is probably going to be looked at as something that was barbaric. But at the same time, it's going to lead to some kind of answer, whether it benefited me or not. At least we'll figure out, if it works, great, let's do that in the future. If not, what else can we try? And maybe that saves my son's life or my daughter's lives someday. And that was one of the outlooks that I had. But I think, from my perspective, I think one of my final thoughts to anyone that's listening or that's recently diagnosed or that, will unfortunately be diagnosed in the future is that you have to be your own advocate. KU is not the only place that I saw doctors at. I went and got a second opinion at one of the leading oncology providers in the country and was basically told to go home and come back if I was still alive 6 months later. Dr. Alcast-Wools and Dr. Sun really invested in my health and my family. And even though I wasn't a candidate for the HIPEC at first, continuing to stay along that route and using that as an option to always bring up with the providers when it seemed like there was no other option, I think that helped kind of push that forward. So just continue to be your own advocate, recognize when your body doesn't feel right. And women are much better at this than men are, but stop putting things off. If you don't feel right, go get it checked out. You might be afraid of the answer, but it's much better to get that answer early on than later on.
Yeah, knowledge is power. And I'm going to end with Sharon's comment. And she says that, Austin, you are so inspirational. I'm praying for your continued healing and good health going forward. And we're so lucky to have such great doctors here in our area. So just thank you so much for this panel. It's such a good, important conversation, especially as you had mentioned, people are being diagnosed younger and younger. Yes. And we got to figure it out and we got to get screened and control what we can control. Dr. Hawkinson, your final thoughts today.
Yeah, it's just going to echo and restate what Austin stated early on in the show. And there is faith and science, and they are not mutually exclusive. And we've even heard Dr. Stites talk about that. I think moving through this world at this time, it's so important to embrace both of those and really look toward those guiding lights.
Thank you so much. And thank you so much for being here with us today. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. Go out, make it a great Monday, and we'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update. It may be a common problem, but not always easy to talk about. Overactive bladder affects 33 million American adults, and women a bit more than men. And it's estimated 17,000 people will die of bladder cancer this year alone. I'm Jessica Lovell. Coming up on the next Morning Medical Update, the risk factors you can control and the advancements in treatment for bladder disorders. See you Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.